Hello, this is Dr. Marina Buckley at Milford MD, and today I'm treating Dr. Richard Buckley. It's actually Friday afternoon, so perfect time for physicians to take care of themselves.
The only time, by the way.
So today we're going to do Thermage, which is a non-invasive modality to tighten the skin, to build up collagen, and also shorten your own collagen fibers so the skin is tighter and not as saggy. So, Richard, why did you decide to go for this procedure?
I decided to go for this procedure because my wife, who's allowing me to talk, so I feel very lucky, said I have to do something. You know, I'm showing signs of time, not aging, but time. And I did have this procedure here before a bunch of years ago. Like all of our procedures, time is not stopped. You know, with any luck, time keeps going, and the years do go by. And so it's time to have what I consider to be shrink wrapping again. And certainly the Thermage procedure, which is what I'm going to get, is the gold standard and has been for some time and continues to be. For me, personally, it has a whole lot of particular benefits. One, I don't really have any time for downtime. It's something I hear from my patients every day as well. They always want to do something with no downtime. So to the degree something will be effective, we do things that provide with no downtime. Also, I was lucky enough to do a little skiing with my kids last week, and so I'm a little bit tan right now. My wife, you notice, is not so tan as I am. That's because she practices, yes, very good COVID-19 protection, sure, but also sun protection all the time religiously. Me, I'm not so good at it, so I have a tan, and so our lasers are not appropriate for at least 3 weeks after any kind of sun exposure. On the other hand, Thermage, which is radio frequency and not a laser, perfect for any time, including right now, today, Friday afternoon. And so I would like my skin to be tighter and younger looking, and I have no ability for downtime now, so this device is perfect. And I know that every day for about the next year, that's 12 months, that's 365 days. So every day, my skin is going to be getting tighter and tighter and tighter. So I'm pretty excited about that. Now, when does that start? That starts after I get the procedure. So, you know, it's nice to talk about procedures and get pricing on procedures, but if you want to get the benefit of procedures, you need to get the procedure. So here I am.
We have a grid. It's a temporary grid. If Richard behaves well, we will remove it. If not, then it might stay for a few months.
Very
and
funny.
We are treating with radio frequency. So it's a monopolar radio frequency. It's the radio frequency that penetrates the deepest. And so it delivers the pulses under the skin, and it creates tightening, stimulation of collagen. Does not affect the color. Any skin tone is fine to treat. And we treat faces, we treat eyelids, we treat legs. You know, areas above the knee is very hard to correct. The skin laxity there, it can be improved with Thermage. We treat the inner portions of arms. Chest can be treated with us. Basically any area that has loose skin can be helped.
Neck, abdomen.
Yes. So on a scale of 0 to 4, we ask the patient to feel between 2 and 3. So you need to be somewhere between warm and hot. How do you feel when you receive each pulse of treatment?
To be honest?
Sure.
0.
0. So we need to increase the heat.
You see what's going to happen now?
Yeah. So we're going to increase the parameters and continue the treatment. As you see, the grid is also on Richard's neck, so we are going to treat the neck as well. How How is this now?
2.
So 2, perfect. 2 is good. We Okay, Amy, can I have a little bit more of the gel? This is called a coupling fluid. It helps me to protect the skin. Also, the handpiece has the cooling mechanism in it, so it's important to deliver the whole pulse. We first deliver cooling, then the heat of radio frequency, and then the cooling again.